If you're diagnosed with COPD, you're not at an increased risk of acquiring the COVID-19 infection. So what can you do to minimize your risk of acquiring this infection? Well, we'd recommend that you follow what the Public Health Agency of Canada has been telling us, to stay at home as often as we can and not to go out for any non-essential activities. If you do go out of the house, to practice social or physical distancing and stay at least 2 meters or 6 feet away from anyone else. To wash your hands as often as you can for at least 20 seconds or use hand sanitizers. My patients often ask me questions about what they should do with their maintenance therapies for their COPD during this pandemic. And the answer is that it's business as usual. You continue to use your inhalers as they are prescribed to you, but you want to make sure that you have enough rescue inhaler and enough of your maintenance inhaler on hand so that you don't have to go out of the house as often as you would need to. I also get the questions about whether they should continue to participate in pulmonary rehabilitation. Well, unfortunately, due to the pandemic, most of the pulmonary rehabilitation programs are all closed for the time being. But that doesn't mean you can't exercise at home. There are many resources online that you can utilize that will help you exercise at home and maintain some of the learnings that you've obtained while in the pulmonary rehabilitation program. What should you do if you think you have the COVID-19 infection and you have COPD? I think the most important thing to do is to inform your primary care provider or your respirologist that you're having symptoms of a flare-up of your COPD. It's going to be a bit of a challenge to figure out if the symptoms you're having are actually COVID-19 or if they're potentially traditional factors that might aggravate your COPD. The symptoms of both of those illnesses are very similar, although fever may be a little bit more common in patients who have an active COVID-19 infection. So that's probably the only thing that would help you differentiate between the two, but that's not 100% of the time. So the most important thing to do is, if you think that you're having a flare-up, is to talk to your primary care provider or your respirologist and follow their directions as to what to do.